It is time now for Morning Rounds. Joining us are CBS News contributor Dr. Holly Phillips and our very special guest this week, Dr. Rudolph Tanzi, professor of neuroscience at Harvard Medical School. First up, a new study finds a strong link between obesity and breast cancer deaths. With Americans growing heavier, researchers say obesity may soon replace tobacco as the #1 risk factor for cancer. 59-year-old Karen Hackett was diagnosed with breast cancer in 2012.
So that first few months, you're just in a daze. Then afterwards, you get into like, what do I want to do to be healthy for the rest of my life? So it was obvious that I should do something about my weight.
In today's study, researchers followed 80,000 women like Hackett who had been diagnosed with breast cancer. They found the risk of dying from the most common type increased by 34% for women who were obese before menopause. Dr. Clifford Huddis is president of the American Society of Clinical Oncology.
That's the novel finding here. We used to think that this association was really seen primarily in older women. Here it's being seen in young women.
A new guide for cancer doctors and patients was released this week. It details the growing evidence obesity can drive tumor growth.
Being heavy may create a kind of rich environment for the promotion of growth of cancer.
An obese person may have increased levels of insulin, which can help certain cancer cells reproduce. Fat tissue can also produce excess estrogen, which is a risk factor for both endometrial cancer and for the most common type of breast cancer. Karen Hackett started eating better and exercising more. She lost 30 pounds.
The thing that you worry about the most is reoccurrence. And this isn't that difficult to do.
To hear that obesity could replace tobacco, I think is shocking to most people. But did this surprise you, Holly?
You know, Vinita, I wish I could say it surprised me, but it really didn't. You know, we've known for quite some time that being obese raises your risk of developing breast cancer and lowers your chances of surviving it. But I have to say, I think the biggest take home here is that we often think about obesity and heart disease risk or stroke risk or even diabetes risk. I think this new frontier of our thinking is going to link obesity directly with cancer.
The link between lung cancer and smoking, for example, would seem pretty obvious. What,
sure.
in terms of the bigger picture, the link between obesity and cancer, what is it?
Right. It's incredibly dramatic. You know, the National Cancer Institute has linked obesity with countless cancers, from esophagus cancer to kidney to thyroid to colon cancer. And by the year 2030, we're going to see an extra 500,000 cancer deaths related to obesity. But, you know, there is some good news here. It's not necessarily about getting skinny. If you are obese, just lowering your weight by 5% can really dramatically decrease some of your risk of some of these cancers. So it's about really trying to modify, even in small amounts, what we can do with our weight to lower our risk.
Right. Also this week, a new report says a commonly prescribed antidepressant may reduce the production of plaques in the brain that are the hallmark of Alzheimer's disease. Dr. Tanzi, tell us a little bit about this report.
Well, this is a new study that showed a certain antidepressant called Celexa was able to reduce a substance in the brain called amyloid. And beta amyloid is believed by most of us to trigger Alzheimer's disease as it accumulates in the brain. It's this gooey, rather toxic substance. And these investigators had shown earlier that a certain neurochemical in the brain called serotonin is able to lower the amyloid levels. And this was shown in mice. So now they took human subjects and they measured the amyloid in the brain following the administration of the drug, and they got a 38% decrease in the amyloid levels.
Does this mean Alzheimer's patients should take antidepressants?
No, this is way too early. We wouldn't say take Celexa because of this study for many reasons. One, Celexa itself has its own side effects. Ironically, one of them can be lack of concentration and loss of memory, so you have to be careful with that. It's also the case that Celexa can have effects on muscle rigidity. But probably the more important thing is that we've seen in clinical trials recently that just lowering amyloid in a patient isn't enough to stop the disease. Amyloid builds up very early, even 15 years before the disease strikes. So to treat a patient by lowering amyloid is too little too late.
Right.
So for that reason, you wouldn't want to take Celexa to treat the disease. Maybe we can learn from this about how to prevent the disease by stopping that initial buildup of amyloid.
The Centers for Disease Control also announced a major new policy this week. For the first time, the CDC is recommending that hundreds of thousands of Americans at risk for HIV infection take a daily pill to help prevent it. The new guidelines tell doctors to consider the drug called Truvada for individuals at high risk, in addition to safe sex practices. 50,000 Americans are infected with HIV every year, and more than 650,000 have died since the beginning of the AIDS epidemic.
A new report from Duke University says children who are bullied may have long-term health consequences well into adulthood. Researchers followed more than 1,400 people for 20 years and found victims of bullying had higher levels of inflammation years after the incidents. Holly, most people know that bullying can have psychological impacts. Tell us a little bit more about the physical impacts and the long-term physical impacts.
Right. And the long-term is really the key here. You know, the study looked at kids starting at age 9 through their 20s, and, you know, they looked at one particular biomarker of inflammation called CRP. Now, this is inflammation in our bloodstream, which is thought to have a bunch of negative health effects. And not surprisingly, years later, the kids who were bullied the most had the highest levels of this inflammation. Kids who were sort of in the middle, did some bullying or were bullied a little themselves, were, you know, right in the middle in terms of their levels of inflammation. But the bullies themselves had the lowest levels of inflammation, the lowest of these negative, what can be linked with negative health effects, which seems grossly unfair somehow.
Yeah, well, now I know I probably have a high level of inflammation. It's good to know after all this. But I'm curious, Dr. Tanzi, Jeff mentioned that there were some health consequences. What are those health consequences if you were bullied?
Well, inflammation generally leads to tissue destruction, and it's a big part of diseases like cancer, heart disease, and Alzheimer's. So this could be a real long-term effect and part of just one's being in general.
A lot of people probably pay attention to that study right now. And finally, an 8-year-old Florida girl was a hero this week when her mother went into labor at home. Vicente Arenas has the story.
Jasmine McInerney is only 8 years old, but when her mother, 29-year-old Crystal Garcia, went into labor early Monday morning, she proved she is wise beyond her years.
I was a little freaked out because, like, she was having a baby and on the floor in the bathroom.
She got very emotional at first, seeing me, you know, crying the way I did, but she pulled it together really quickly and definitely came through for me.
Jasmine, can you get some dry towels and a blanket to wrap the baby in and try to find a string or a shoelace?
Emergency crews were on the way, but Jasmine's little brother JJ just couldn't wait.
Oh, the head's out. The head is out.
Okay.
Oh, I feel the head.
Tell Jasmine to support the baby's head and shoulders.
Can you support the head and shoulders? Oh my God, is he alive?
She's really slippery. Tell her not to drop.
Come here. Hold the baby's head, please. Oh my God, she's freaking out. She's only 8 years old.
An EMS crew arrived minutes later to finish what Jasmine started.
Look at you. Hi, can I get a hug from you? You helped me so much.
Crystal credits 911 dispatcher Emily Hall with helping keeping her and Jasmine calm under pressure during the 8 minutes that felt like an eternity. For CBS This Morning, Vicente Arenas.
Oh, that's awesome.
Oh my gosh, she's freaking out. She's only 8 years old.
No, I see a future of medical school for that little girl, though.
Dr. Holly Phillips and our guest, Dr. Rudolph Tanzi. Thank you both.